question for you. Who's excited to be here? Thank you. Oh, who's nervous to be here? It's not just me. It's not just me. Okay, good. All right, so my name is David Lewis, and I'm the men's program manager for Roads to Recovery. Also a former peer and resident of the Roads to Recovery program. And most importantly, I am a person in long-term recovery. And what that looks like for me is I haven't found it necessary to use any mind-altering substance since October 9th of 2018. And because of that, I'm able to live a life that I never thought I was able to live, guys. And I'm really honored to be speaking on the topic I have for you today. It's the value of peer services. And, you know, I just really am happy to be speaking on it because this is the stuff that helped change my life for the better. Whoa. So going into our agenda, we're going to talk a little bit about me, and I'm going to start out by talking a little bit about myself and my experience with peer services, go into a little detail about my recovery journey, and then we're going to talk about the variety of work settings, outcomes and impact of peer services, and then revenue, production, and return on investment. But before I do, if anybody feels uncomfortable by doing this, it's okay. And I'm sure it's pretty much everybody in this room, but by a show of hands, who here is in some form of recovery? Yeah. Yeah, give yourself an So I had it mapped up in my head what I was going to say, and I forgot. You know, so I'm going to be giving a lot of evidence-based information on this topic and supporting that. But you know, when I personally think about what the value of peer services is, I'm looking at you. That's the value of peer services, and it's what we do every day to help our other peers because the peers that we serve are also the value. And it's just it's a really beautiful thing, isn't it? So, who wants to hear my story?
We do.
All right. All right, so I grew up in a small town in West Virginia called Princeton. And I was exposed to drugs and alcohol at a pretty young age, like 10, 11. I started using pretty heavy around 13. And it was a smokable green substance. So, you know, I started using, but the older I got, the more my using progressed, the harder the substances became. So, you know, fast forward, by the time I was 20, by the age of 24, my life was completely unmanageable. I could say my life was pretty much in shambles at that time. And I want to touch base on, you know, my rock bottom gift of desperation, stuff that we talk about when we share our story to others. I was 25 years old. Well, I was about to be 25. I was about to be 25 years old, and I was living in my mom's basement. And it was an unfinished basement. There was a rock wall around me, and you know, nobody really wanted me there because of the things I was doing. And at that point, she really didn't want me there because she told me I had to go. So at that point, I had used up all my money. My girlfriend had left me at the time. My mother was kicking me out of the home. So I did the only thing that I knew that I thought that I had no option to, and that was a suicide attempt. Luckily it didn't work, and it sent me to a psychiatric hospital. I'd been to that psychiatric hospital a couple times, but I'd never been engaged in any type of recovery services. I'd never been in 12-step fellowships. I'd never had engagements with other peers or anything like that. It was just get really bad off, go to the psych, come back out, keep going. So at that last run to the psych, my mom, she gave me an ultimatum. She said, hey, if you want to come back and live and you want my help, you're going to have to go to a treatment center. So she found this really nice treatment center in Florida. So after I was done with my stay in the hospital, I went to this treatment center in Florida. I believe it was called the Watershed. It was it was a pretty cushy spot for me at the time. You know, this under middle class kid from West Virginia. The life kind of seemed like a vacation when I got to Florida. You know, it was awesome. I never really left the state, so that's just kind of what it seemed to me. Because again, I didn't know what recovery looked like. I just thought this was who I was, and I thought this was how I was going to be. And I just thought people were messing that up for me, you know? So once I got there, I started to learn more about recovery services. I started to learn about the 12-step fellowships. I started to learn about peer services a little bit. And then 2 months went by, and I was ready to leave treatment. And I had two options: either go back to West Virginia and live with my family, and kind of pick up where I left off there. That's just kind of how it seemed to me at the time. Or come here to Virginia and live with my brother, who'd been living here for quite some time. So that's what I did. I came here to Virginia. I moved to the town of Bedford with him, and I lived in Bedford for about 4 years. And in Bedford is where I was introduced to the 12-step community pretty heavily, because before I left treatment, they set me up with IOP. They gave me meeting lists. They did all those things that they were supposed to do. And I didn't really get involved in IOP, but I did get involved in a 12-step fellowship. And I want to say I stuck with it for a while, but I didn't. You know, once I got back on my feet a little bit, and I was living with my brother, and I started working, and I got a girlfriend. And it was so convenient. I found the girlfriend in the 12-step fellowship. It was awesome. You know, once I got all these things that I had lost and given up back in West Virginia, things just felt right again. So, you know, eventually I started using it again. So for the next 4 years, it was just kind of this back and forth pattern, I'm sure, that you guys can relate to, coming back in, going back out, coming back in. And I did that for 4 years. And in that 4 years, I was incarcerated. I was arrested several times. You know, I picked up, if not worse, where I left off in West Virginia. Excuse me. So, the last stint I did in jail was 30 days for a DUI, and I went into the jail with 4 months of recovery under my belt. You know, I knew that, I don't think I was fully committed. I just knew that I had a lot riding over my head, so I was doing my best to try. So I went in there with 4 months, and I had a lot of intentions to keep trying once I was released. But the day I was released, some stuff happened in my personal life that I just felt it necessary to use it as an excuse to use again. So that's what I did. And within 2 weeks, I was homeless, I was jobless, and I was back. Once again, I was desperate. So that's when I reached out to Roads to Recovery. And that was on October 7th, 2018. The secretary, Sandy's secretary at the time, I left her like 6 back-to-back Facebook messages. Somebody gave me her contact, and I hit her up at like 4 o'clock in the morning. So I landed myself in Roads to Recovery. And once I got to Roads to Recovery, I was really confused. I just wasn't really sure who I was anymore. I just, you know, I thought I had it all figured out in my head, but I didn't. And that's how I want to touch base on peer services, you know, because once I got into Roads, I was assigned a recovery coach. That's what we call our peer recovery specialists at Roads. We just call them coaches. So I was assigned a coach, and the day that I got to Roads, he came to Bedford to pick me up from the job that I just got fired from. And, well, the lady, she said, she's like, you're not going to work here, but you need to, she's like, I'm doing this for you. She's like, because you're not going to leave if I don't let you go. Because I was just so messed up. So my first recovery coach's name was Jim, and he picked me up, and instantly I had a relation with him because he knew where I was at that time, and he told me that, you know, our stories weren't exactly similar, but the things that I told to him and the things he told to me, we had that relation, and it was really powerful for me. You know, I felt safe in a car ride, 20-minute car ride that I didn't know, somebody I didn't know, going to a place that I wasn't sure of. I felt safe, and that really made a big impact on me. So I got to my house, a month goes by, I get a job, and all through that, I'm working with other peers in the houses, I'm working with other peers at the office, and they're showing me that life, what can be really fun. And I've got some pictures to prove that. So these are a variety of pictures from both when I was receiving services as a peer in Roads to Recovery and also being employed at Roads to Recovery. But one thing they all have in common is every person in these pictures is a peer. And you know, we're all bonded that way, right? So some cool pictures. We've got a really cool outdoors program. They've taken us camping, canoeing, hiking, a couple pictures of our recovery event that we do every year. 2 different years in these pictures. And we've got a kumbaya moment we're having, singing Lean On Me together on stage. That was really awesome stuff. So once I was continuing to receive services from Rhodes, and I was doing really well. I had about 2 months of recovery under my belt, and then people just kept telling me, you know, I think I want to do more. I think I want to get involved more, and they're just like, do service work. I'm like, well, what does that look like? It's like, just do it. Just go help somebody. And I was like, okay. And luckily, the guy in my house, he had a sponsor at the time, and his sponsor, he worked for another nonprofit in the community, and I offered to be of service, and he allowed me to do some volunteer work there. And I was working with peers, I was working with younger people, we were doing groups, we were taking trips, and it was awesome. And this guy saw the work that I was doing, and you know, I think he just saw something in me that I didn't see in myself for sure at the time, but he asked me if I wanted to get involved in his peer training that he was doing. And I got involved in peer training. I took the 72-hour training, and when I started that training, the first day I wanted to duck out because I was just so unsure of myself. I was full of doubt, and I went to the facilitator. I said, hey, I just don't think I'm going to be able to do this. And this is just another example of great peer services because he reassured me that I was supposed to be there. And because there was people in there with 10 years of recovery, 30 years of recovery, and it was a different mix, and it was my first exposure of what peer services looks like. Because you know, I've been to 12-step meetings, and you know, I've gotten that bond with people, but you know, from a professional realm, I was just so full of self-doubt. It was crazy. So once I completed that training, I was working with that organization trying to get my service hours, and then Roads to Recovery offered me like a little internship to get my service hours. And not long after that, Roads to Recovery offered me a part-time job. And then not long after that, they offered me a full-time job. So, and that was 3 years, almost 3 years ago. You know, so I've been working with Rhodes, and I've been able to watch myself and my coworkers and also my peers grow, and as we watch the organization grow and do all the things that we're doing. And I'm telling my story, you know, not only to share my strength and hope, but also share how I've been able to change my life and how the process of peer services really work. And I think that's about it with my story. So.
You're going the wrong ones.
Oh, sorry. All right. So now we're going to talk about a variety of peer work settings. So this list really only scratches the surface as we continue to be used in more and more ways in the behavioral healthcare system. But the first one I'll talk about is in our freestanding RCO. An RCO stands for a Recovery Community Organization. It's an independent nonprofit organization led and governed by representatives of local communities of recovery. That's what we at Rhodes are. Working at an RCO, I've come to appreciate the flexibility that we have. We are able to work in the gray areas. We don't experience as many barriers as working in other agencies, and I get to work in a lot of different environments. And this isn't to say that working for an RCO is better than the rest, but I am grateful for the freedom that we are able to experience. Next on the list is behavioral health clinics. These agencies are employing more and more peers to help support their clients, and we'll talk more about that on the next slide. And the next is FQHCCs, that stands for Federally Qualified Health Centers. And we've got a couple of these here in Lynchburg, we have our biggest referral that Rhodes uses is the Community Access Network, and they are an FQHC lookalike. But the biggest one we have is Johnson Health Center. And these are medical providers that provide many different types of care. And our local hospital system contracts peer recovery specialists to work in their emergency department, specifically in overdose situations. I think we're all aware of peer specialists working in treatment centers. We provide one-on-one coaching, and sometimes we facilitate groups. So then we have before, during, after formal treatment, or in lieu of treatment. An example of this, as a peer specialist, I support people all the time that aren't always ready for treatment yet, whether it's working with drop-ins at a recovery center or referrals from other organizations. And this happens regularly. We go and speak directly to patients in treatment centers about our organization and how we can support them at their next transition. And then there's the fact that many of our referrals to our residential program come straight from treatment. At Rhodes, we get admissions straight from treatment, before treatment, sometimes in lieu of treatment, and sometimes people who don't even complete treatment. And then we have jails. The Virginia Department of Corrections continues to hire more and more peer recovery specialists to work both within the jails and prisons, as well in probation and parole. And we're going to give a big shout out to Ciandra Lewis and her big team of peer recovery specialists. And we have housing facilities, and I'm not sure if we have any in our area. But something that we do have that Rhodes just helped open is our low barrier homeless shelter. And we're employing, and we're employing almost exclusively peer recovery specialists. So that's opening up a whole new setting for peer recovery specialists to work in. So hopefully we can continue to grow with that. Can anyone give me any examples of different peer work settings that I haven't mentioned?
Let's say we've got a housing facility that's staffed completely by peers. First one in the state in Louisville.
Nice.
And we have 8 peers working there now. We have 2 a shift, 24/7, 365, and can house up to 7 people.
Awesome. Thanks for sharing.
We have a co-response here working with the market select program.
Could you speak up a little bit, sir?
We have co-response peers that are going out with the market select program.
Uh-huh.
That. So we have
Nice.
people that are out there.
Awesome.
Drug court?
Drug court. Yeah.
Managed care organizations, MCOs, insurance companies.
Thank you.
Peer-run drop-in centers.
Peer-run, did you hear that one, David?
I didn't.
Peer-run drop-in centers,
Oh.
like on our own.
We've been
There we
talking
go.
a lot about that.
Yeah.
Make it a shout out.
We've got Chesterfield Police Department in the chat. They are employing peers now.
And the
Wow.
warm line centers too.
Warm line
Line.
centers, yeah. Yeah, CSB is no big deal.
Yep. Yeah, we're gonna talk a little bit more about that, actually. All right. And then, moving on to our next topic, is outcomes and the impact of peer services. So increased abstinence rates. People that engage in peer support services, have a higher rate of abstinence in achieving long-term recovery. And in this picture is a very special day. We have our CAO, two beautiful people in this picture, I'm just saying. Mark Bogie, he was just on the stage giving his speech.
I don't recall signing a release.
And then we have Goldie King. She is actually our women's house manager at one of our homes, and she is also a transportation associate for our organization. She gives rides to all of our peers, to meetings, doctor's appointments, work, etc. And on this day, she's celebrating a really special day. She got her rights restored.
So it's the thing about Goldie real quick, it's never too late to find recovery. She is 70 years old.
2 years now? Yeah, 2 years.
Yep.
Yeah. So that's just a good example of outcomes and impact. And in the same realm, people that engage in those services also stick around longer inside the system of care. Some of our area CSBs are seeing much higher retention rates with their clients when they are receiving peer services. People in treatment, greater satisfaction with treatment. So people in treatment report greater satisfaction with treatment services when peer recovery specialists are more heavily involved in their care. Improved allocation of resources, and it saves clinical provider time. Peer recovery specialists are a lower cost workforce, so we can be utilized to fill gaps and save provider time. That is an all-time need. And then we have increased connection to communities of resources, because we are what? We're resource brokers. Yeah. And I didn't realize how passionate I was about being a resource broker until I started getting really heavily involved. And sometimes it feels like a hit and miss, when we're working with somebody and we develop a good relationship with someone and we can't get them exactly what and they know that they need, and especially when you've been working so hard, but there's always the good days when you do get somebody something and it feels really good. I was reflecting on that, and I was thinking about a couple that I was working with a month ago, and they walked in. They were unsheltered, and they just walked in, and I was sitting on the couch, kind of having a little break that Mark hates that I do. And I saw them walk in very briefly, and then they walked right back out. They looked at each other, they whispered in each other's ears, and they walked back out. So I got up, I put my phone in my pocket, and I walked out the side door, and I caught up with them in the parking lot, and I introduced myself, and I told them who I was, and I kind of gave the recovery center spiel, and they said, okay, it was nice to meet you, and they kept walking. And then 10 minutes later, they come back into the recovery center. And on that day, they were in need of emergency shelter, and once talking with them a little longer, they wanted to be in treatment. They were just running into a lot of hiccups because they wanted to remain together. But regardless of that, I was able to get them the resources, they may have not needed, that they may not have wanted right then and there, but I was able to get them some pretty good resources that I knew they needed. I gave them the number to CHIA, which is a homeless shelter hotline in our community. I knew they could get connected with somebody to get put on a waiting list. I gave them plenty of information on pantries in the community. I gave them information on where to get a meal with a food kitchen. You know, so that was just a good example of what resource broken looks like. Does anybody have a good resource broken story? Go ahead.
Hi, everybody, Shirley,
Hey, Shirley.
Middle Peninsula CSB. So we're partnered up with the Medical Integrated Healthcare System in Westmoreland County. And Karen and I, my coworker, went to our first community meeting with the person leading there. And during that conversation, she had 29 cases, which had resulted in 198 911 calls from 2 months. And during that conversation, she had mentioned a lady that was involved in a domestic violence situation and was stuck because she had 2 children and didn't know where to go. So, and she didn't have a connection with them, with her. That was a Wednesday. The following Saturday, the lady called her, and because we were there and gave her a resource to use, this lady called. She was in a situation where she couldn't get out of. She ended up in the shelter that night, and is still safe today.
Okay, then we're going to move on to, let's see, increased connection to communities of recovery. So so we connect people to communities of recovery because that's how many of us got recovery. Data, I'm skipping ahead, I'm sorry. We connect people to communities of recovery because that's how we got recovery. So, talking a little bit about that, you know, again, just with my story, I don't think there would be anybody in here if that's basically our job. Like, we want to connect people. We want people to sustain recovery. We want people to do well. And that's the best, other than our love and support, that's the best we can do, is just getting as many resources as we can and letting them choose their own pathway. And then we have increased connection to communities. Oh, I just said that, didn't I? Reduced hospitalizations. Some data from SAMHSA shows that people engaged in peer services are less likely to need hospitalization. And then we have the big one, improved quality of life. And we know that abstinence plus improved quality of life equals long-term recovery. And then we have a study here that was concluded in 2014 titled Peer Recovery Support for Individuals with Substance Use Disorders, Assessing the Evidence. And also we have a good picture of a few of our peers. This was a really cool day. We had a cookout. I was on the grill. Before I got involved in peer recovery services, I was a cook. That's all I really did. So it says peer providers are an increasingly important part of the treatment and recovery continuum, and they also help create an environment and community where recovery is supported and individuals are working toward a better community. Okay, does anybody, before we move to the next subject, does anybody have any questions or would like to say anything? Yes, ma'am.
When you guys are implementing the programs that you have, do y'all collect data on the outcomes of your effectiveness?
We do. We're currently using the ARMS platform with backed by VAR. Yeah.
Thank you.
You're welcome.
Can you tell me more about that low barrier shelter that just opened in Winter?
Sure, I can tell you more about that. Tell you a little bit about that. So we just opened that about 3 weeks ago, about three, 4 weeks ago, and it's, you know, when we say low barrier, that's exactly what we mean. There's no, we're not requiring any negative drug screens.
Right.
We're
Breathalyzer?
nothing,
All right.
nothing like that. We're,
What about-
sorry,
What about criminal histories?
nothing like that. We don't do background checks.
If they had any kind of violent history in the past, it's not gonna affect them?
I don't think so, no. Though we kind of keep it case by case with whatever, you know, if something was serious, was to happen in that situation, then we would just handle it case by case and address it then.
That's awesome. Congratulations, that's amazing.
Thank you.
'Cause I can't tell you how many times I've run into situations where someone had like a domestic dispute from 10 years ago and they can't get service.
Yeah,
So,
it was
good for you.
So we started we started doing this when two of our homeless shelters shut down in our community. It was the Hands Up Lodge and the Men's Gateway program. And Sandy and Brian and Mark, they reached out to I can't remember the name.
Miriam's house.
Yeah, Marion's house, and they got with them, and then that, you know, about 2 months, like 3 months later, we already had the building, because we're also starting a non-clinical detox center eventually, but we're now using the top part of this building as the low barrier shelter. And give a shout out to, oh, she's not here. Did she leave? So, never mind. She did a lot of help. She's one of our newest peer workers in our organization. She did a lot of help with Brian and Sandy and Mark getting everything together, and she's working primarily at the shelter. You know, and it's like I mentioned earlier, it's like it gave us the opportunity to offer peer workers a new job position.
So if a person's not from the local area,
Doesn't matter.
really?
Yeah.
Would Chia be the point of access?
Chia is the
Okay.
point of access.
Cool, thank you.
I
Could someone
think,
technically call and they could say, we got a bed if you bring them in the next 4 hours?
so you have to coordinate directly through Chia. You know, there kind of was no other way around that. So they call Chia. We've been pretty full. The people that are actually in the shelter right now, they were on some vouchers, and they were on a waiting list, waiting for us to be ready with the renovation. So as soon as the renovations were done, we moved them directly in.
So awesome.
Yeah, it was pretty awesome to watch. All right, moving on. All right, so now we're getting into the fun stuff. We're going to talk about revenue production and return on investment. For those, and I was in this boat, I didn't know what an ROI was for a little while. It's return on investment. And it just means, for example, if we spend $1 on peer services, the return on that investment will be between $2 to $3. And FQHC in Denver, Colorado, found that for every $1 invested in peer services, they got an ROI of $2.28. And we'll talk more about that, why the ROI on peer services is so high on the next slide. Medicaid, other third parties, and I'm sure most people in the room knows that the Medicaid reimbursement rate for peer services increased recently, and hopefully that will lead to more accessibility for those services. We have substance abuse and mental health block grants, which are both federal funding that can go directly to providing peer services. Then we have SAMHSA, access to recovery services and recovery community service programs. And these are federal grants that organizations must apply for. There is a set amount of money and awards that are given out with each kind of grant. And then we have state and local appropriations, money appropriated directly from either the state or local government for an entity to provide recovery services. Health departments. Health departments fund peer support. Our buddy Carl Mack, he's right there. He is. Yeah, buddy. He's speaking tomorrow, and he's employed by the Virginia Department of Health. And yeah, they're doing great things with peer services. And then somebody mentioned drug courts. I'm going to talk about that and other justice system funding. We're seeing more and more effectiveness of having participants engage in peer services. Because of this, we are seeing them employ or contract peer recovery specialists in roles within the courts. Virginia Probation and Parole is also using more peers in their local offices. And fees for service, that's what Rhodes does. We provide the peer services, we don't bill any insurance, and we work with each participant to help them have the resources to pay for our services. We have service contracts, and that's just another thing Rhodes does. We're getting more involved in providers of employee assistance programs. They contract with us to provide the employees with peer services. Excuse me, and I've been allowed to handle that head on here lately. That's been really interesting. For example, if a guy tests positive for THC at his job and he's given an ultimatums, he has to reach out to a third-party contractor, and then that third-party contractor reaches out to us, and then we get that peer set up with group services. Like, he typically has to reach like a certain amount of hours. It's, you know, it would be similar to IOP, it's just not with that clinical aspect. And then he would have to give probably random weekly drug screens and stuff like that, and then he would do that for an amount of time, and then hopefully he would be able to return to work once he's complied with that. Service contracts. Another thing Rhodes does, we are getting more involved in providers of employee assistance. Oh, I just said that. Oh my gosh. Local grants. We apply for and receive several local grants each year to grow our services. This is a bad thing about having this, and I can't look at you all the time, but I'm getting better. We apply for and receive several local grants each year to grow our services, like the Centra Foundation, Genworth Foundation, Greater Lynchburg Community Foundation. These local grant makers are integral in helping us help more people. Can anyone share a revenue producer that I have not mentioned? Okay. All right, so growing evidence base for effectiveness. Here are some of the reasons why that ROI is so high for peer services. More and more research that is being done, both the effectiveness and value of peer services continue to show why our workforce is one of the fastest growing in the behavioral health field. Everything's better with peers, right? Yeah. We don't just produce revenue, we save the system of care a lot of money, which goes into the next bullet. Reduced rehospitalization rates. People that are engaged in peer services while they're in inpatient treatment, they're less likely to have to return to the hospital, which lessens the strain on emergency departments and saves the hospital systems a lot of money for, I hate to say it, but for bills that are not likely to get paid, right? So, and that leads us to, that leads us to lowered overall cost of care. And folks that are connected to peer services also have a smaller average days spent in inpatient treatment centers. And all this adds up, right? It all adds up to lowered overall cost of care, which we all know is a huge reason why hospital systems all over the country are working so hard to become more and more efficient. And then we have increased use of outpatient services. We continue to see that peer recovery specialists are great at bridging people to outpatient services like medication management, caseworkers, counselors, etc. And when people are engaged in more services, it typically equals less strain on crisis services, less emergency department and crisis stabilization visits. Increased engagement. So not only are people more likely to get connected to other mental health services, they are also more likely to stick with it and engage at a higher level when they have a peer recovery specialist working with them. There tends to be more of a buy-in with these clients when they're working directly with peers. And then second to last, we have increased whole health and quality of life. Again, we know that improved physical health and quality of life leads to more long-term recovery. Peer recovery specialists help motivate people to achieve these things. And then lastly, We have strong evidence for improved management of chronic conditions, person-centered care, and satisfaction with care. And this sums up my slides. Thank you. So if you guys want to, please get engaged with me. Let's talk a little more. You got any thoughts, questions, or discussions? I didn't take up all the time that they expect me to take up.
David, another revenue producer is something that we started, which is our cottage industry. If you want to tell them about restoration and repair.
Yeah, restoration and repair. So yeah, we started a cottage industry about 3 months ago called Restoration and Repair, and it's looking, it's kind of looking like a construction and renovation company. That was started, and we're actually hiring directly our peers in our program. So the only people that work for us right now are our peers, and it's pretty awesome. They helped us do the renovations on the homeless shelter. They're going to continue to help us do our renovations for our detox center, and then we're also going to get other contracts as we move forward. Thoughts, questions, discussions? I wanted to talk to you guys. Yeah.
So when you guys have individuals that come into any of your programs, do you have any arms of your programs that will support their family members?
Yes, we have we have a slot for a family support specialist. We've had several people working in that position. We don't have anybody working there now. And we also facilitate a family support group, which we're actually not doing right now because we don't have someone to coordinate that. Typically, the people that we hire to do that, they kind of just branch out and move on to the next thing for them, which is good. But yeah, we offer family support.
Are the groups you're doing hybrid? When you were offering, was it hybrid? Was it something?
Not at the moment. Everything that we offer, all the groups that we offer at the Recovery Center are in person.
What type of groups do you offer?
We facilitate some of our own groups. We have a group called Motivational Enhancement. We have just some center-based groups that are called Recovery and Focus, and that's just an in-person open discussion group. Just recovery. It's very broad of what the topic could be. And we also host SMART meetings. Actually our senior recovery coach, James McFeely, he facilitates that. He's certified to facilitate SMART. And we have women's groups, we have men's groups, we have a community group that we do for all of our peers. We have Recovery Dharma.
Recovery and faith.
We have faith-based recovery groups.
Mara. That's
Mara.
hybrid. That is
hybrid. Thank you. Let's see.
Smart hybrid?
Nicotine recovery.
No, we don't have smart hybrid. We have
nicotine
smart
recovery.
No,
Yeah,
hybrid.
he asked if it was hybrid,
Oh, no, sorry.
which is something we could work on. Let's see. We host the building for 12-step fellowships to come and have meetings. Our idea was just to use our facility as a hub for recovery services. Just so people could have a place to come, get connected, and just
One of
go
our
wherever
most
they want.
well-attended and well-liked things is coffee and conversation.
Yes.
It's not planned, it's
Yeah.
everyone, and budget sitting down, cup of coffee, talk. And it's
Yeah.
one of the most popular things we offer.
Yeah. Any other questions? Yeah. Yeah, sorry, sir. I didn't see your big arm waving there. I'm sorry.
I was
It's the
going to
light.
put the light up. My question is, the individuals who are in the shelter, do you have programs for when they ready to leave or help them find housing upon leaving the shelter?
So we're working case by case to do our best to help them. We don't have anything directly saying.
So homeless services are a different animal, and we're learning as we go. But the only thing we're allowed to require in the low barrier shelter is people need to be willing to pursue permanent housing. Everything else is by invitation only.
How many beds do you have?
9 right now. We'll expand later
That's
this,
just-
early February. We'll go up to 16 or 17.
Is that just men or is it men
No.
and women? It's
No.
co-ed?
Girls, men, women,
No children.
No children.
Nope.
but we have a women with children home.
What about men
recovery.
with children?
Yes, men can have their kids,
Okay.
have men with children.
Any other questions? All right, well, thank you guys so much.